Imagine a world where you take suppressors drugs several times a day to live a normal life. You cannot find a job. You live under stress, awaiting another illness attack. For safety, you need somebody around who will know how to help you. You are excluded from the society. People don't understand your illness. This is a world of epileptics. Epilepsy is a chronic neurological condition characterized by recurrent seizures. There are many types of seizures and their symptoms can vary from a momentary disruption of the senses, from short periods of unconsciousness, to convulsions. Epilepsy is usually treated with medication called anti-epileptic drugs to stop seizures from occurring, but they do not fully cure epilepsy. Epilepsy leads to multiple interacting medical, psychological, economic, and social repercussions. The prevalence of epilepsy in Europe is 8.2 per 1,000 people. Thus around 6 million people in Europe currently have epilepsy, whilst 15 million people will have had epilepsy at some time in their lives. The top 4 most frequently reported etiologies of epilepsy: trauma, central nervous system infections, cerebrovascular disorders and perinatal risk factors, are preventable. The age distribution of the incidence of epileptic seizures and epilepsy is bimodal, with 2 peaks of frequency, in childhood and in the elderly. Did you know that the number of hospital beds for epilepsy care is 5 times more in Europe than in America? Sense, an emergency monitoring system designed for mobile devices. Sense architecture consists of 4 main parts. Biomedical remote monitoring. Sense utilizes the smartphone advanced sensor infrastructure in order to detect and identify the potential health threats and seizures for people affected by epilepsy. The solution is using electromyograph sensor for detecting muscle activity during potential epilepsy attacks. The application improves quality of life of people with epilepsy by increasing sense of security. Easy to configure broadcast information about the attack to friends and medical services allow them to provide normal life without stacking under stress and awaiting another illness attack. In our understanding, applications innovation factor is based on delivery of biomedical data fusion, very and simple, widely available mobile application. Sensor data fusion considers EMG, GPS and accelerometer in order to scan the patient's organisms in search for seizure symptoms. Developed for the project, hardware is state-of-the-art wireless EMG sensor net placed on the body and integrated using Wi-Fi network to create the basic health state status calculated by eye mechanisms. We have already experimented with neural networks and rule engines to develop a health state classifier. When the possibility of seizure occurs, system activates voice alarm and a countdown for alarm cancellation. Furthermore, user can react if the application creates too many false alarms, and even more, the application can learn how to detect false alarm using human behavior. If the alarm is not interrupted, system starts an emergency procedure by notifying defined set of individuals and medical institutions. Integrated web portal. Application has been integrated with web portal where users can access their statistics and reports about prescriptions, seizures and location of events. The portal collects data about seizures, GPS-tracked positions, muscle activity and schedule of taken medicine. Considering this information, we are building a patient's knowledge base and providing medical situation awareness for epilepsy monitoring and treatment. The Sense application has a modern and intuitive interface designed also for elder people who have no experience with mobile devices. The application design has been formed around good practices of GUI design and graphics placed in Metro-style documentation. Windows Azure Services. Cloud computing environment delivers effective way for data persistence, efficient disease reasoning mechanisms and reduce the risk of data loss. Emergency communication channels. The reliability of the emergency procedure is increased by utilizing various kinds of communication channels, SMS, voice messages, and social media like Facebook, Twitter, which provides means of creating circles of trust for people involved in helping epileptics. And life makes sense again.